Can I have the mic, please? I'll just
Hello? Can we have people at the back sitting, please? Can you request the people at the back to sit, please?
Do you want me to run the presentation? Sorry? Do you want me to run the presentation
No,
for you?
no.
You will be able to do it? Yes.
A very good morning to all of you. I'm going to change the structure of this session a little. We hardly had any time for the questions from the audience. So I'm going to actually start the session with questions from the audience. And I hope we have mics for the audience here. Smart city is a topic that we've all been hearing about. Media is full of it. You do Google on it, and you get lots of data on smart city. So my first, and I need two people from both the sides to talk about what is your expectation from smart cities. So somebody from this side, please. Can we have a mic going here? Anyone, what's your expectation of smart city when it comes to healthcare? We have a volunteer.
Ma'am, I'm Dr. A.K. Singh and I'm from Jaipur. Now, when you talk about smart cities and healthcare, generally, if you go down to any of these foreign countries, if there is an emergency, the ambulance reaches you in 2 minutes. Here we have to depend, the government probably doesn't have the capability to handle this. Even the private people do not have that kind of a thing, so emergencies takes a lot of time. Now, what I would want in a smart city is that if I ring up a particular number, say 900, I want that the person, a paramedic should come to my place and help me out of my emergency. That's it, ma'am.
Thank you so much. Anyone from that side? And we'll elaborate more on what his thoughts are. Anyone from that side? Any volunteer as to what you think your expectations from smart city, first of all, before I start on smart city? Am I talking about a new subject? Okay, so let me begin. So let me first of all thank the organizers for this wonderful conference. We have a wonderful audience here, which is superb. I attended the last session. I think very good thoughts came in. Some of the things that I actually want to repeat from the sessions, the previous session was, somebody said, healthcare is still an ICU. And what can we all together do to ensure that healthcare comes out of ICU? And I think there are technologists here, there are there are doctors here, there are academicians here. So how can we together work on making sure that this works? And from how do we move from secure to prevention? I think these are two things that I really took up from the last session. And let's see how we can build on it for the smart cities. So my definition of smart city, I just hope the slides are clear, because I found in the last session while I was sitting in the seats below, the slides were not very clear for whatever reason. So my thought of what a smart city really consists of is a smart home, a smart people. And when we say smart people, it actually even takes care of what he just mentioned. If a person is actually being transported in an ambulance, are we in the city ensuring that he gets a clean way? That also is covered as part of the smart people. Smart mobility, we had a lot of discussion in the last session on the smart mobility, so I'm not going to cover that. Smart economy, smart governance, and smart environment. But when it comes to smart people, it's all about education, it's all about health, participation in the public life, and participation in the community advocacy. Can I, this week I think is going on as an organ donation week. So can we actually talk about advocacy of organ donation and how it can help people who really need the organ? So that's also an advocacy that the smart city has to really talk about. Let's look at some statistics. And where do I come to the statistics from? we are actually going to experience a lot of change in the coming couple of years. And sensors, we did hear, and I'm going to talk more about sensors in the coming part of the presentation, is actually going to connect almost everything. It might even enable a patient anywhere to get the treatment where he wants to get the treatment. And what we actually seeing is that the Internet of Things based, which is going to be used extensively in smart city, we're going to see an increase in the numbers in the healthcare, and we're going to see a massive increase coming in the smart homes also. And that's what actually is possibly going to enable us to ensure that a patient is able to get the treatment where he wants it or in his house itself. The smart city also takes care of the transport, which actually covers what the gentleman just mentioned, that if we just had a recent case, there was a liver that had been transported from Gurgaon to liver hospital in Vasant Kunj in Delhi. And it was done in 11 minutes. And I'm sure if people have experienced traffic in the morning today, I'm sure you realize that this, typically that distance takes almost 45 minutes to 1 hour. But that was done in 11 minutes, and it actually saved some lives. So all this actually is going to constitute the smart city. So what is smart city really talking about? We're talking about, and in specifically context of healthcare, I'm going to dwell more on it, is trying and taking healthcare to place where the patient is. And patient could be home, patient could be at the accident area on the road or wherever it is, and the medical care should reach him wherever he is. Some more statistics. So we are going to see a massive increase in some kind of things happening, devices, sensors, which will possibly connect the patients from anywhere to anywhere, is what is expected. So I'm talking about two things actually. I'm talking about smart city and I'm talking about Internet of Things. And they're both going to work together to actually give you what is required for patient. What is also there as part of statistics is the life expectancy is expected to increase by almost half a year because of the health monitoring which is coming in. So let's look at what customer wants. So as a consumer, we heard one consumer. I don't know with any other consumer who wants to talk about what his expectation is from the smart city. But if I was to look at a mother who's expecting, she wants in a smart city, she wants her child wherever she is, whether she's in office or she's at home or she's in the hospital, the baby, which is unborn baby, to be monitored. So could there be a way that the child can be monitored? Could we manage the fetal heart of that? IVF is another thing that we're all hearing about. Can we also have in smart city some provision of stem cell storage? Can we also have ovary storage? Can we also have some kind of a genome chart so that actually we can go in for prevention? For emergency, we heard in the previous session, we need immediate care, and that's what is required. Post-op cases, we all saw a lot of ads, and some people who've been staying in Delhi, I'm sure all of you have seen some ads in Delhi which say that you can get released after the operation in 48 hours and then taken care of it at home. So can the post-op care be at home? Similarly, can the chronic diseases be managed well at home? So this is what a customer is wanting in addition to what the hospitals are providing today. So is that going to be covered as part of the smart city? Possibly, yes. What's already happening in healthcare, and I'm actually taking you to not, we've had talks about EHR, we've talked about HIMSS systems, but we're going to the next stage. So we already have today remote consults, teleconsults happening. We already have tools for assisted living. We already have tools for medication compliance, fall detection. I've already come across people where instead of going for dialysis to hospitals, there are some countries who actually started that dialysis can actually happen at home rather than taking a patient all the way to the hospital. We certainly, all of us have actually experienced ECG and fetal heart monitoring kind of system. Mobile patient asset tracking is of course there. In Australia and a lot of other countries, people have actually started working on early pneumonia detections. And how does that happen? This is all with help of sensors, and I'm going to dwell more onto it. And of course, with people with disabilities, and there are a lot of support systems where visually impaired people can actually walk now with available tools. and people can hear, people actually, the signal from the mind can go and, based on that, there are tools which have been created so that people can actually do different things. So I'm actually going to, before I go on to what can happen, I'm going to quote Vidut Khosla here. He says, in the healthcare stations of tomorrow, maybe in a smart city, patients will be able to walk into an advanced healthcare station without appointment and also give their medical updates to maybe personally chosen devices or private schemes. And they'll be able to tell based on the EHR and the other data as to what patient has to do. So it'll be a combination of the sensors, it'll be a combination of electronic health records, it'll be a combination of decision support systems that we just heard about and talked about, and so on and so forth. So maybe there's a possibility that, like we have ATMs of today, where banking transactions happen, I might be able to walk to an ATM of healthcare, where I can just put some sensors on my hand, and actually the sensors will be able to detect and give me at least first level of advice, which is what the future is going to be, and possibly future of smart cities. So let's see what can happen. Let's look at what is a possibility. And this slide actually depicts what can be automated. So like we said, you can take an ECG, you can take, say, blood, DNA, protein, etc. So what all can we take as a data? We've all heard about Sony PlayStations. So what is the concept of Sony PlayStations? They basically take, they do read the, how your mind is working, or how your eyes are working, and based on that, some decisions are taken by the PlayStation. So what they do is basically they use the concept of EEG, and they are able to have a game which a child can play in his house and get a feel as if he's playing in the ground. Now, similar concept, can we use that concept to help a visually impaired person to walk, or maybe a person who cannot speak, can we help that person to actually bring his thoughts onto maybe a computer or a mobile device? So there's a lot that can happen in terms of what all these sensors can actually pick up as a data and help maybe a patient, maybe an old age person, or any person with some kind of help that's required to actually have a better living. Some devices which are already there, I thought I'll just talk about these. So there are already some people who created devices with things like contact lenses which actually monitor glucose level. You have hearing device boosters, you've got heart rate monitors. So all this actually is going to give you, when they combine together, a better livability in a smart city. So there's something which we're already seeing. There was an article that I read just a couple of days back, where in a hospital in China, there was a child whose skull was blown because of some liquids in that, and they were able to recreate the skull of a child with 3D printing. So that's what technology is taking you to tomorrow. You already have people who are coming in with artificial kidneys. You already have limbs which are created by 3D printing, and with different kind of sensors installed in your body, they're connected. So this is what is a new thing which is coming in, which is Internet of Things, which is going to change our lives, which I personally feel smart city is going to use in addition to the hospitals, in addition to the EHRs that we've been talking about. So the reason why I actually gave you this was because I know there are a lot of clinicians here, there are a lot of startups here. I think there is a need for a lot of innovations in healthcare and Internet of Things, which will actually change the look of smart cities. In fact, as part of Digital India launch on 1st of July, our Prime Minister also launched a Center of Excellence for Internet of Things, which is the first one of it's going to be in Bangalore. What we plan to do in that Center of Excellence is to give you complete systems, all starting from sensors to a big data analysis, a complete platform, so that you actually can create your products, you create your innovation, or create your health device, which actually can then be used for smart city or improving the livability of people. So thank you. I'm going to go on to the different panelists. We've got a very, very nice set of panel here. So, we're starting with the Kripa, and she's going to talk about what is required in terms of rehabilitation, how do we take care of post-op, and how do you take care of the chronic disease burden in this country actually for, to make it a smart city. Thank you.
Thank you, Dr. Neena. Today, I'm going to speak about the role of rehab and chronic disease management in healthcare, especially so in smart cities. But before I begin, I just want to ask everyone a question. So why does a smart city exist to begin with? Why is it so special? What makes it different? So now, do we have something more redefined or something more super defined than what rural versus urban is? Are we heading towards the next definition of rural versus urban and now versus a smart city? If we are going down to a super definition, saying a smart city is much more refined than what we would have in an urban city, it would be more technologically advanced. That being the distinction, it certainly should have certain aspects which will make it more smart. Smart is just not technology. If it is not healthy, the entire smart city is an unhealthy smart city, certainly not what we want. So more than a smart city, I think we're already heading towards a healthy smart city. Health being the first and the most primary aspect of a smart city is what I believe and what I would think of. Why? Is because a smart city is technically an urban or a tier 1 city, as we know, with many of us actually flocking towards. You have a lot of migrant population coming in and making that city so special. And what really happens is with this population influx is that you have to take care of every aspect. At the end of the day, everyone really wants to come and earn. And if they're not healthy, they're not going to earn. Probably the ultimate motive of a smart city is also economy. And if you're going to be not going to be healthy, economy is not going to be helped with. So having put that first, health is the first primary angle through which a smart city should be looked at. So having said that, why does it only have to be a certain aspect of healthcare? For me, it is the entire life cycle, the entire lifespan, the entire of not only just the age brackets, the type brackets and every horizontal and vertical sectioning that needs to be envisaged when we're talking about healthcare. This having been said, rehabilitation is an essential part, is a quintessential part of health continuum care, because a patient cannot be treated and left. Many of the failures in treatment and diagnostics happens after the diagnosis and the treatment has been given, because many a times the patient really follow-ups are not being taken, compliance to medication, rehabilitation, getting back to where the patient really needs to be or the individual needs to be does not happen. Is where rehabilitation, the essence of rehabilitation comes in. And in smart cities, I think the highlight would be that everyone would be working, and with technology being the key factor, they would all be more so having a very sedentary lifestyle. So what kind of diseases are we looking at? These will be more of chronic-based diseases. They would be more of lifestyle-based diseases. And what really happens is a person falls ill either due to his lifestyle, his genetics, or his habits. Technically, we really cannot change genetics. But if we are really going to get predictive about genetics with smart healthcare and smart healthcare prediction, it really helps. But what about those people whose lifestyle is wrong, whose dietetics are wrong? So that is where rehabilitation as the entire spectrum from between dietetics to post-op care to rehabilitative physical care comes into being. All of this put together, when we talk about rehabilitation, it is essential that a person goes back to the point where he's able to be functionally able. And it's often said that a good life is one where you usually avoid a doctor. Sorry to say, but we're all from the medical field. But the burden of health and diseases itself is very, very burdensome. So I would like to really be healthy and productive in order to make this city a smart city. That would have been the tagline that I would have used if I were to be a citizen. A smart city, healthy citizen. So this is my point of view towards rehabilitation. And post-operative cases, we've heard a lot about, especially ophthalmological cases failing. It does not happen if you look at the percentages that happen during surgery and post-op, you see actually the entire data is biased and it is lopsided towards post-op care. Many of them go back home and they have an infection. So the entire spectrum of care between diagnosis, treatment, everything falls apart. It all becomes a failure. Health becomes a failure just because the taking it towards closure does not happen. And taking it towards closure for another healthy beginning does not happen. So the importance of healthcare and rehabilitation is where it comes into the post-op part. Chronic diseases is really a big problem. All of us today are becoming, we are all aware that India is becoming the next diabetic capital of the world. Next should certainly be the chronic disease capital. If we're going to go this way, we'll have many of our smart, healthy population who are working, moving towards a geriatric land, having chronic diseases, and they will never get there and actually be, they'll contribute towards a burden in the smart city rather than being an asset to the smart city. This too